Hello everyone, it's me Dr. Ayaz Ahmed. I am working as an aesthetic dermatologist. Today I will discuss another important topic of dermatology. The name of topic is gonorrhea. Hopefully you will learn and subscribe my YouTube channel. Definition: it's a sexually transmitted bacterial infection caused by Neisseria gonorrhea, principally causing purulent inflammation of genitals, mucous membrane. Vertical transmission during childbirth may also occur. Synonym and inclusion: the synonym and inclusion include gonorrhea, sexually transmitted disease, sexually transmitted infection, gonococcal throat infection and conjunctivitis, oropharyngeal gonorrhea, anal and rectal gonorrhea, ophthalma neonatorum. Epidemiology: it is common in developing countries like Asia and Africa and Latin America. Estimated new cases are 106 million per year worldwide. Most common in teenagers, in men as well as in women in early 20s. In UK, the male aged 20 to 40 years of age and female aged 16 to 90 years of age are most predominantly affected. Male to female ratio is 2 is to 1. Infection in male are homosexually acquired. Generally, gonorrhea is 2 to 3 times more frequently reported in men than in women. Pathophysiology: Neisseria gonorrhea is a main pathogenic bacteria that survive only inside human being. It has high infectivity, can easily be transmitted before symptoms appear. Socioeconomic, behavioral, and pattern of sexual mixing affect this spread. Predisposing factors are female gender, homosexuality, pregnancy, menstruation, SLE, IV drug user, and HIV infection. Gonococci attach to its host mucosal surface with the aid of villi, undergoing antigenic variation in which it changes their antigenic type. It penetrates between the cell and enter in subepidermal space. It also multiply intracellularly and then exit from basal surface of cells, leading to inflammation, microabscess, and purulent discharge. This is the structure of a gonococci bacteria. You can see gonococci are a round shaped bacteria, gram negative. These bacteria have lots of flagella. With the help of these flagella or pili, they enter inside the subepidermal space and then into the cells, causing inflammation, microabscess, and ultimately leads to purulent discharge. Clinical presentation: it may be asymptomatic or moreover symptoms are acute urethritis with burning urea, profuse purulent discharge in male, rectal and pharyngeal infection, cervical lymphadenopathy, excessive vaginal discharge, dysuria, postcoital and intramenstrual bleeding in female, conjunctivitis leading to panophthalmitis, and vein damage, usually with first week after the birth in babies. This picture describes the milky white discharge from the male genital area. This is due to infection of gonococci. This is another example of purulent milky white discharge, but here the organ is the vagina in female. The most primary site for the gonococci in female is the cervix, that may leads to discharge that is coming from the vagina. This is the involvement of gonococci in eye area. The infection of gonococci in eye is characterized by swelling, inflammation, pain, and conjunctivitis. This is another example of gonococcal infection, especially in babies soon after the birth, usually during first week of the birth. This is characterized by the swelling, conjunctivitis. This may lead to panophthalmitis, which ultimately results in the vision loss. Differential diagnosis. Differential diagnosis include chlamydia infection, non-specific urethritis, trachoma vaginalis and ectopic pregnancy, genital herpes and pelvic inflammatory disease and UTI. Thank you very much. Stay connected and subscribe my YouTube channel.